I'm Dr. Christine Dorbach, the founder and chair of World Information Transfer. The world's media are filled with news accounts of the continuing deterioration of our planet and ecosystems. The ecological and economic damage that has accumulated since industrial times is finally becoming publicized through recent media coverage and information campaigns. While we have seen increased reports of air pollution, ozone depletion, and the growing threats presented by toxic contaminants, they have rarely examined the specific relationship between human health and the deteriorating environment. Solid medical research has been conducted, but has not been widely disseminated to the public. In the following video, we will take a look at some highlights of 3 international conferences which for the first time offered a global platform for this relatively underreported subject, the delicate health of the human species and the complex environment they live in. Thank you for watching.
In June of 1992, over 100 heads of state from around the world gathered in Rio de Janeiro for the United Nations Conference on Environment and Development, which adopted a plan designed to deliver a sustainable future for all mankind. The first article of the Earth Charter declaring such principles states that human beings are at the center for sustainable development. They are entitled to a healthy and productive life in harmony with nature. Perhaps not so well known are a growing number of dedicated scientists working in research laboratories and healthcare facilities around the world, studying the impact of environmental contamination on public health. A number of such scientists gathered at the United Nations headquarters in April of 1992 to present groundbreaking reports and research concerning the specific relationship between environmental degradation and health. The conference was organized by World Information Transfer, commonly known as WIT, a non-governmental organization affiliated with the United Nations. Spurred by the Chernobyl nuclear accident, WIT was formed in 1987 to assure that opinion leaders and other concerned citizens around the world would have access to objective and authoritative environmental information.
As an NGO associated with the United Nations, WIT has been very instrumental in working on the level of NGOs in preparing for the World Summit at Brazil. We feel that the pursuance of implementation of the recommendations of that conference could only be attained through the good work of non-governmental organizations working side by side with the various governments of the world that had participated in that conference. The United Nations certainly feels that the cooperation of international NGOs and in some cases even national NGOs is most essential for carrying out the various tasks, especially on the economic and social levels.
We've come a very long way since the first time that we conceived of the idea of having a series of conferences and a program, in fact, to highlight the issue of health and the environment. And since the time that we had the first conference, I believe we have managed to sensitize quite a lot the public opinion, and we've managed to involve many governments in the exercise, and we've also, I think, contributed very significantly to the debate by bringing in professional expertise and information which is relevant to many of the key issues of health and the environment today.
First International Conference, April 3rd, 1992, the impact of a degrading environment on human health and the search for solutions.
The first international conference was supported by the government of Ukraine and was chaired by Dr. Christine Durbach. Ambassador Alexander Borg-Olivier, a leading diplomat, was executive director of the program, and Bernard Goldstein, one of the world's leading experts on environmental medicine, was program chair. The following are some highlights of the presentations made at the conference.
Dr. Bernard Goldstein, Director of the Environmental and Occupational Health Sciences Institute in New Jersey, was the first presenter and introduced the topic, the environment as a cause for human disease. He said that too often we disregard the interrelated systems underlying environmental problems. Deforestation in poor countries can create conditions that endanger human health, such as the erosion that caused flooding in the Bay of Bengal in 1991. Dr. Goldstein said that efforts directed at sustainable development that fail to understand the complex relationship between human health and the environment are doomed to failure.
Sustainable development, as we talk about it, is really impossible without healthy humans able to sustain that development.
To look at the
Dr. David Bates, professor of medicine at the University of British Columbia, presented a talk on the environmental causes of respiratory diseases. Dr. Bates said that it was not surprising that respiratory diseases are dominated by environmental factors, since the lung is the most vulnerable organ continuously exposed to the environment. High levels of particulate pollution in developing countries point to about 4 million deaths per year for children under the age of 5. The luncheon keynote address was presented by Yuri Shirbak, the Minister of Environmental Health in the Ukraine. He described the alarming predicament the Ukraine were challenged with after the aftermath of the Chernobyl accident and expressed concern over the potential long-term health effects.
3/4 of the poor people in the south live in ecologically fragile areas. It is estimated that at least 14 million have become on a yearly basis environmental refugees, driven from their homes by ecological degradation.
In the afternoon, Dr. Jacobo Finkelman, Director of the World Health Organization in Metepec, Mexico, gave a fascinating presentation on environmental health in developing nations of the Americas. He described man's ability of transforming the ecological system to his advantage in a variety of ways, seriously damaging the environment in the process. In developing countries, poverty and rapid urbanization have tended to exacerbate environmental problems to almost unmanageable proportions. Traditional diseases linked to inadequate sanitation and to malnutrition, such as cholera, are highly prevalent. In 1991 alone, more than 388,000 cases of cholera were reported in Peru, causing almost 3,000 deaths. Dr. Finkelman also linked pesticide use to 80,000 fatalities, mostly occurring in developing countries.
children are very vulnerable to many toxins.
The last speaker was Dr. Philip Landrigan, chairman of the Department of Community Medicine at Mount Sinai Hospital in New York. He explained that the health threats from exposure to environmental toxins are greater for children than for adults. Additionally, children are far more likely than to develop diseases with long latency periods. Children around the world are widely exposed to pesticides, air pollutants, inorganic lead, and asbestos. 200 million children under the age of 14 are employed, mostly in developing countries, and are exposed to a number of environmental toxins.
All this information suggests humans are increasingly at risk as our deteriorating environment takes its toll on our physical well-being. While the problem is to some degree hidden, the medical consequences, supported by sound research, are all too clear. Closing the panel discussion, Dr. Goldstein said the agreement among participants was strong on the predictability of the information. It is only a question of time before the next Bhopal or Chernobyl happens. We can also predict how many lives will be saved, how many respiratory conditions will not occur if we plan accordingly. We can talk in terms of what will not occur if we take the necessary steps to halt the degradation of the environment and its perilous consequences on human health.
Second International Conference, April 30th, 1993. The Deteriorating Environment and its Relationship to Human Health.
It is 1 year since we held the first conference on the topic.
Dr. Durbach opened the second international conference to an invited audience of over 700 policymakers with the notion that much has happened during the past year to convince us even more of the need to establish more links between environmental degradation and the health of the people of this planet. The 1993 conference was co-sponsored by the government of Egypt and was officially opened by the permanent representative of Egypt to the United Nations, His Excellency Dr. Nabil El Arabi.
The theme of the conference, health and environment, is no doubt at the very top of the list of environmentally related priorities throughout the world.
In the sense that hardwood forests are...
The first presenter was Dr. Robert Shope, an epidemiology specialist at Yale University. He outlined major findings concerning global climate changes and infectious diseases and said that increases in ambient temperature had a direct correlation to disease, since this rise hastens the transmission of infectious agents. Dr. Shope cited the dengue virus, spread by mosquitoes, which would spread north and south from the tropics into temperate zones. The potential for severe epidemics will be accentuated if the human population continues to increase.
and infectious diseases and other environmental hazards.
Dr. Oswide, Director of the Ministry of Health, Food and Drug Administration in Nigeria, was the next speaker. Dr. Oswide focused on food safety and expressed the importance of education to maintain sensible hygienic practices in homes, particularly in the tropics.
The keynote address was about bilharziosis and was presented by Dr. Abdullah Abaraya, the Undersecretary for Endemic Diseases in Egypt. Bilharziosis is a major cause of liver and urinary tract diseases, including bladder cancer, and is endemic in 76 countries, infecting 200 million people.
Prevalence was 16.8%.
Last year,
Dr. Wadi Haddad, a special representative from the World Bank, noted that over 1 billion people in developing countries have no access to clean water or sanitation services. Unsafe water is a major contributor to 900 million diarrheal cases every year, causing the death of more than 3 million children. Providing access to sanitation and clean water is the single most effective means of alleviating human distress.
These environmental problems contribute to the creation of the most conducive conditions for the proliferation of diseases which are taking an enormous toll on the population of the developing world.
Dr. Vamek Volkan, a director at the Center for the Study of the Mind and Human Interaction in Virginia, gave the last presentation. He described how psychoanalysts and psychiatrists have been working closely with diplomats, studying and defining ethnicity and the psychological factors undermining ethnic conflicts. Above and beyond real-world issues, psychological factors play a major role in international relationships.
Wherever we have ethnic conflicts, we are going to ruin a lot of things. And so where I come from is another way of looking at these issues, and also with all humility saying that psychologists cannot resolve these problems, but we need to put psychological, in-depth psychological insights in in the environmental issues and health issues. Thank you very much.
A variety of new data and viewpoints were presented at the 1993 conference, managing to elevate the topic of health and environment to a new level of understanding, particularly as they are clearly affected by a number of interrelated socio-economic factors. Underlying the human-induced environmental situation are the relentless demographic forces of population growth, currently at an annual rate of about 90 million. This is accompanied by unprecedented population movements, notably rural to urban shifts in developing countries, and the flow of large numbers of people from poor to rich nations, often described as environmental refugees. The risk of epidemics increases as people on the move take their diseases with them, and are often exposed to new diseases when they reach their destinations.
Third International Conference, April 15th, 1994. Nutrition, Contamination, and Health.
On behalf of the government of Malaysia, I would like to welcome you to the Third International Conference on
The
Health
third
and Environment.
Health and the Environment Conference was officially opened by His Excellency Mr. Ismail Rizali, the permanent representative of the Malaysian government to the United Nations. In 1993, Mr. Rizali was elected to be the first chairman of the Commission on Sustainable Development, which was a working group established at the Earth Summit to monitor the progress and implementation of Agenda 21.
The government of Malaysia is pleased and honored to co-sponsor and work closely with the World Information Transfer in making this conference possible. The government of Malaysia has invested significant resources to protect its citizens from the ravages of ill health in all aspects. We measure the well-being of our country to a significant degree on the general health and robustness of our people. The Malaysian government remains fully committed to the programs of Agenda 21 and to the program of Chapter 6 specifically. I thank you for the occasion. Thank you.
Thank you very much.
We do know a lot about the causes of cancer, and without doubt, smoking remains the single most important preventable cause of cancer in modern countries. But infectious diseases and poor nutrition are major determinants of leading causes of cancer in developing countries, where cervix, liver, esophageal, and stomach cancer predominate, and infectious diseases and nutrition are major determinants of those forms of cancer.
After welcome and introductions, Dr. Deborah Lee Davis from the Department of Health and Human Services in Washington, D.C. presented the first paper. The subject was Patterns of Cancer as Clues to Environmental Causes. Dr. Davis said that in 1992, cancer care and treatment in the United States cost $60 billion. Smoking remains the single most preventable cause of cancer in modern countries. If we manage to reduce exposure to cancer-causing agents in the environment, 100,000 lives in the United States would be spared each year.
Dr. Alexander Kurchenko, director of the Research Institute of Oncology and Radiology at the Ministry of Health in Ukraine, was the next speaker. The subject was Food Contaminants in Human Disease, Aftermath of Chernobyl. Even 8 years after the nuclear accident, the concentrations of cesium and strontium still pose a great radiation threat and contaminate an area of over 513 square kilometers where 2 million people still live. In addition, pesticides, nitrates, and heavy metals are present in the food and water, exceeding admissible levels by a 10-fold factor.
Contaminated foodstuffs are significantly lower than maximum permissible limits, and consequently it was not necessary to reduce the intake of contaminated food.
The Malaysian Deputy Minister of Health, the Honorable Dato Maud Farid Arifin, presented the luncheon keynote address. Mr. Arifin said that environmental health impact assessments should specifically report and comment on the potential effects on human health, rather than just providing data on emissions and ambient levels of pollutants. In Malaysia, a legislative framework has been set in place to achieve sustainable development. Standards must be set in the spirit of global partnership to solve global problems, such as ozone depletion and acid rain, which cannot be solved by one nation alone.
In the developing countries, the major environmental health concerns are still those environmental factors contributing to the spread of infectious diseases, all of which require provision of safe water, basic sanitation, adequate shelter, availability of food, and handling practices, controlling disease vectors, and agricultural hazards.
And now in Rwanda,
in the afternoon, Mr. Malawi, the former spokesperson for the Department of Public Information of the United Nations and a special envoy to Somalia, provided some final remarks. He said that humankind is largely responsible for spoliation of the environment, and much of this can be attributed to the misuse and abuse of natural and other resources. Nevertheless, it is a fact that wars and recent ethnic conflicts, in which the worst and ugliest in human character have come to the surface, have caused unprecedented environmental problems.
Ladies and gentlemen, your concern with the serious effects of environmental threats to human health is most admirable. But let us not underestimate the devastating effects of wars and armed conflicts on the environment and health. And despite recent setbacks, the international community must not allow any conflict to fester and spread. There should be no relaxation in pursuing fair and rational application and enforcement of international humanitarian and environmental laws and in the respect of human rights.
You're well aware that there are vast differences in food availability and dietary patterns worldwide. Some of these differences can be explained.
When the meeting resumed, the next presentation was by Dr. Shusma Palmer, Director of the Central European Center for Health and the Environment in Berlin. Her topic was diet, nutrition, and health. She discussed the long-term health effects of the high-fat, affluent diet which have become apparent in the last few decades in industrialized countries, contributing to chronic diseases such as coronary heart disease, cancer, and obesity.
According to Gopalan, who is the guru of nutrition in India, as the population moves up the socioeconomic scale, you can see a sharp drop in consumption of cereal fibers and a sharp increase in consumption of fat. In some parts of the Indian population, among the elite, among the higher socioeconomic group, fat already makes up more than 30% of calories. This is comparable to what you find in the West.
We are seeing, as we progress year after year in our efforts through WIT and many other venues.
To sum up the day's events, Dr. Goldstein reiterated the commonly expressed view that sustainable development is not possible without healthy people. He commended the efforts of world information transfer and said that governments around the world are beginning to take the subject of health and the environment more seriously. As an example, he cited the Malaysian government, who are placing environmental factors as a top priority, while at the same time recognizing the need for development, growth, and the health of its people. Dr. Goldstein closed the historic meeting reflecting on the scope and dimension of the challenges that still lay ahead.
It means that our population diminished, and the reasons are both...
We are reminded of the statement from His Excellency Ambassador Batuik of Ukraine, who described the problem so eloquently at the first international conference. Our country is very beautiful, but when people do not swim in the lakes and rivers, when we are afraid of picking mushrooms in our forest, you know this is not nature, but the environment. If you can bring a horse to the water, but cannot make it drink. The animal knows that the water is contaminated. We are in the forefront in the fight to restore the beauty and health of nature, and in this way, to restore the better conditions for human life.
And by this way, to restore the better conditions for human life.
As we have heard from our experts, our deteriorating environment is damaging our health, increasing cancer and asthma, and lowering our immune systems. If we use this knowledge wisely, we can elect officials that will focus on this issue. Finally, we should remember that the greatest gift we can leave our children and grandchildren is a healthy environment, developing healthy people. Thank you.